Sepsis is a serious medical condition that requires immediate attention. It is a life-threatening response by the body. It occurs when the body's response to infection starts to harm its own tissues and organs. This can quickly lead to organ failure and even death if not treated promptly. Sepsis is a silent killer, often striking without warning. Patients may feel fine one moment and be critically ill the next. It's like a fire alarm going off in your house, and instead of just calling the fire department, you decide to flood the entire neighborhood. Sepsis is a time-sensitive condition. Every minute counts when it comes to diagnosing and treating sepsis. Early intervention can mean the difference between life and death. Our bodies have an amazing defense system called the immune system. This intricate network of cells, tissues, and organs works tirelessly to protect us from harmful invaders. It protects us from harmful invaders like bacteria, viruses, and fungi. These microscopic threats are constantly trying to breach our defenses and cause infections. Think of it as an army standing ready to defend our body from enemies. Each component of the immune system has a specific role, much like soldiers in a battalion. When we get an infection, our immune system leaps into action. It identifies the invaders and mounts a coordinated response to eliminate them. It sends white blood cells to the site of the infection to fight off the germs. These cells are like the foot soldiers, directly engaging with the pathogens. This battle often leads to inflammation, which is a natural part of the healing process. Inflammation helps isolate the infection and signals the body to repair damaged tissue. However, in sepsis, this normally protective immune response goes into overdrive. The immune system's reaction becomes excessive and starts to harm the body itself. The inflammation spreads throughout the body, causing damage to organs like the heart, lungs, kidneys, and brain. This widespread inflammation can lead to organ failure and is life-threatening. Sepsis is a complex condition and can be triggered by any type of infection, from a minor cut to a serious pneumonia. Even seemingly harmless infections can escalate into sepsis if not properly managed. It's not the infection itself that causes sepsis, but the body's extreme response to it. Understanding this response is crucial for early detection and treatment, which can save lives. Sepsis is a medical emergency, and recognizing its symptoms early is crucial. The challenge is that sepsis can be tricky to identify as its early symptoms can mimic other conditions. Common signs of sepsis include high fever, rapid heartbeat, and rapid breathing. You might also experience confusion, disorientation, or slurred speech. These symptoms indicate your body is working overtime to fight off the infection. Other red flags include chills, clammy skin, and decreased urine output. Pay close attention to any signs of infection, such as redness, swelling, pain, or pus around a wound. Remember, sepsis can develop quickly, and these symptoms can worsen rapidly. If you experience any of these signs, especially after a recent infection or surgery, seek immediate medical attention. Early detection is absolutely critical when it comes to sepsis. Think of it like a fire. The sooner you detect and extinguish it, the less damage it will cause. The same principle applies to sepsis. Doctors use a combination of tools and assessments to diagnose sepsis. Blood tests are crucial, as they can reveal signs of infection and organ dysfunction. Other tests, like urine cultures and imaging scans, can help pinpoint the source and extent of the infection. There's a saying in medicine, "Time is tissue." This rings especially true for sepsis. Every hour that passes without appropriate treatment increases the risk of organ damage and death. If you suspect sepsis, don't hesitate to seek immediate medical help. It's always better to err on the side of caution when it comes to this life-threatening condition. Section 5. Fighting back. Treatment strategies for sepsis. Once sepsis is diagnosed, swift and aggressive treatment is essential. The goal is to stabilize the patient, control the infection, and support organ function. The first line of defense typically involves intravenous antibiotics. These powerful medications are administered to target and kill the bacteria causing the infection. Since the specific bacteria is often unknown initially, broad-spectrum antibiotics are used first. In addition to antibiotics, patients with sepsis often require supportive care. This might include intravenous fluids to maintain blood pressure, oxygen therapy to assist breathing, and medications to manage organ function. Sepsis is a complex medical condition, and treatment often requires a multidisciplinary approach. Doctors, nurses, respiratory therapists, and other healthcare professionals work together to provide comprehensive care. Section 6. Prevention is key. Reducing the risk of sepsis. While sepsis is a serious condition, there are steps you can take to reduce your risk. Understanding these steps and incorporating them into your daily routine can make a significant difference in your overall health and well-being. Prevention primarily revolves around minimizing your chances of getting an infection in the first place. This means being proactive about your health and taking necessary precautions to avoid potential sources of infection. One of the simplest yet most effective ways to prevent infection is through good hygiene practices. Regular hand washing is a cornerstone of infection prevention and can significantly reduce the spread of harmful bacteria and viruses. Wash your hands frequently with soap and water, especially before eating, after using the restroom, and after being in public places. Make sure to scrub all parts of your hands, including the backs, between your fingers and under your nails. Keep any wounds clean and covered with a bandage until they are fully healed. This helps to prevent bacteria from entering the wound and causing an infection, which could potentially lead to sepsis. If you have a chronic illness like diabetes or heart disease, work with your doctor to manage it effectively and reduce your risk of infections. Proper management of chronic conditions is essential in maintaining a strong immune system. Vaccination is another crucial aspect of sepsis prevention. Staying up to date with your vaccinations can protect you from various infections that could lead to sepsis. Vaccines protect us from a range of serious infections that can lead to sepsis, such as pneumonia, influenza, and meningitis. By getting vaccinated, you not only protect yourself but also contribute to the overall health of your community. Vaccines are one of the most powerful tools we have to protect ourselves and our communities from infectious diseases. They work by training our immune systems to recognize and fight specific germs, preventing illness and reducing the risk of serious complications like sepsis. Several vaccines are particularly important in the fight against sepsis. The pneumococcal vaccine protects against pneumonia, a common cause of sepsis, especially in older adults. The flu vaccine reduces your chances of getting the flu, which can weaken your immune system and make you more susceptible to other infections. If you have any chronic medical conditions, such as diabetes, heart disease, or lung disease, talk to your doctor about which vaccines are recommended for you. Keeping your vaccinations up to date is crucial for maintaining a strong immune system and lowering your risk of sepsis. Recognizing the signs of sepsis and seeking immediate medical attention can be life-saving. Remember, sepsis can progress rapidly, so time is of the essence. If you or someone you know experiences any of the following symptoms, especially after a recent illness, surgery, or injury, call 911 or go to the nearest emergency room right away. High fever or low body temperature, rapid heart rate, rapid breathing or shortness of breath, confusion or disorientation, slurred speech, extreme pain or discomfort, clammy or discolored skin. It's always better to err on the side of caution when it comes to sepsis. Don't hesitate to seek medical help if you have any concerns at all. Effective communication is paramount when it comes to managing sepsis. This involves clear and open dialogue between healthcare providers, patients, and their families. If you are being treated for sepsis, don't be afraid to ask questions about your condition, treatment plan, and potential complications. The more informed you are, the better you can participate in your own care. If you are caring for a loved one with sepsis, be sure to communicate openly with their healthcare team. Share any concerns you have and ask for clarification on any aspect of their treatment. Remember, sepsis is a team effort. By working together and communicating effectively, we can improve outcomes for patients with this life-threatening condition. Sepsis is a serious public health concern, but it's one that we can tackle together. By raising awareness about sepsis, recognizing its symptoms, and seeking prompt medical attention, we can save lives. Hospitals and healthcare systems play a crucial role in improving sepsis care. Implementing early warning systems, standardizing treatment protocols, and fostering a culture of open communication are essential steps. But sepsis awareness is not just a medical issue, it's a shared responsibility. Educate yourself and your loved ones about the signs and symptoms of sepsis. Share this information with your community and encourage others to learn more. Together, we can break the silence surrounding sepsis and make a real difference in the lives of those affected by this often overlooked condition.